Morning, and thank you all for coming to this forum. There are two premises behind this forum. One is that the Affordable Care Act creates new opportunities to stabilize and improve the health of vulnerable, low-income people by expanding the reach of Medicaid beyond those who were already covered because they met categorical eligibility standards. The second premise behind this forum is that we have a very limited supply of affordable housing. HUD's programs do not begin to cover all of the need for deep rental subsidies, and those programs, there are 5 million units of subsidy altogether, are unlikely to be expanded anytime soon. The low-income housing tax credit is producing additional units of affordable housing every year, but only some of those units are available for the lowest income and neediest people. Therefore, it makes sense to begin to target subsidized housing to a greater degree than it is now to people for whom subsidized housing can do more than simply lower their rent burdens. And an important group among those people are those for whom living in stable, affordable housing can stabilize their health and improve their health conditions, as well as providing them with decent, safe, and sanitary housing. I'd like to draw your attention to a list of proposals that it's in the left-hand side of your packet. It's this two-sided one-pager. These proposals are not official positions of apt associates or official positions of any of the organizations represented by our panelists today. Rather, they're intended to provoke discussion about a set of options. The proposals are intended to increase the use of affordable housing by vulnerable populations and to improve access to community-based health care and related supports. We've assembled two distinguished panels this morning to discuss these issues. The first, to my right, is composed of senior officials from HHS and HUD. The second panel will be composed of other housing and health experts, advocacy group representatives, and industry groups. We've given both panels the same charge to discuss the full set of proposals, both those that relate to housing programs and those that relate to health programs. I've asked each of the panelists, all who have had both this document and a more extensive document, which you will also find in your folder, but this is probably all you need to look at. I've asked each of them to react to any of the proposals that they want to, any on which they have special interest, special expertise, to agree, to disagree, to provide context, more information, more different perspectives.